Hi, my name is Jeff Gaisley, and I'd like to welcome you to the video on tri-brain trauma therapy, which is a therapy that I developed and one of the new schools of energy psychology, which is a revolutionary new way to treat clients who are dealing especially with trauma, but also for other mental health issues. It greatly reduces treatment time and any distress that clients feel going over past traumatic issues in order to resolve them. Thank you very much. The name of my treatment model is called tri-brain trauma therapy. It is my belief that if the entire mind-body continuum is not adequately addressed in treatment, especially the three separate yet connected brains, and the even greater primitive brain web within the body's individual cells, treatment results will be incomplete. Traditional psychological treatment often ignores the deeper brains, while most energy psychology ignores the conscious prefrontal cortex. When I first began to study psychology in 1970, there were three main schools of thought about human behavior. The oldest was psychoanalysis by Sigmund Freud. The second was the behaviorist school by B.F. Skinner. And the last was the client-centered and humanistic school by Carl Rogers. We were told by our professors that we needed to pick the one school that would describe all human behavior, and that if we weren't able to, then we would be termed eclectic. These teachers made it very clear that in their minds, eclectic was simply lazy thinking. This was certainly not what I wanted to hear, because I felt that each of the three schools of thought seemed quite valid. With the advent of brain imaging and the increased knowledge that has been derived from them, it has now been ascertained that many of the basic tenets of each of these psychological systems are in fact valid. Each of the three brains and the body-brain processes information and learns differently. Freud has been proved correct about the existence of certain instincts and drives. His concept of the repetition compulsion is also accurate. These phenomena have their realm in the deepest and most primitive part of the brain, in the medulla oblongata and the limbic system. Skinner was correct in that we learn by repetition in the concept of reward and punishment. The tendency for human beings to group their learning by the process of stimulus generalization is also correct. The limbic system, which is the center of our emotions, learns in accordance with operant and classical conditioning, at least in part. The medulla oblongata, and to a large degree the individual cells of the body, conform to this learning model as well. Carl Rogers and the other existential and humanistic psychologists were also correct. Human beings are capable of independent thought and rational thinking in the prefrontal cortex. We are not simply run by stimulus and response, but rather able to exercise a mediating discretion about our world. The primitive web, which consists of each separate cell of the body, made up of the neuropeptides and other informational messengers, has further complicated the issue of what makes a person feel, think, and act. This system reacts before any conscious thought, and it might be more accurate to view it as our prime instinctual system. It is certainly subject to many behavioral learning principles. In order to really understand human behavior and affect change, all of these brains need to be addressed equally. Unfortunately, many therapists continue to focus on one brain and one type of theory. This thinking results in partial truths and piecemeal understandings that do not do justice to the full complexity of what it means to be human. This same type of either-or thinking and excessive specialization is also present in the antipathy between allopathic or Western medicine and alternative healthcare practiced by chiropractors and homeopaths. The same closed-minded thinking can be seen by many MDs who often don't even believe in the efficacy of vitamins, and the equally myopic views by naturopaths who denigrate antidepressants even when the client is suicidal. My early training was steeped in experimental psychology in school and working in a teaching hospital as a ward clerk, orderly, and psych tech. I then worked at psychiatric hospitals, pain clinics, and community mental health centers for many years while I went to school to obtain my master's degree in counseling. After I left school, I worked in general counseling, chemical dependence, and family systems. I developed a deep respect for traditional medicine and psychology, but saw many limitations in the excessive specialization and side effects of many of the medications that were used routinely. I found my way to alternative health care quite by accident. I hurt my back while working in a hospital and went the traditional route of trying to obtain medical care. Because of my experience working in pain clinics in the 1970s, however, I would not allow the doctors to fuse my back. When the pain continued, I began to experiment with hypnosis, TENS units, biofeedback, massage, and chiropractic care to manage the pain. This was only partially effective, but I discovered how helpful hypnosis could be for temporary relief and trauma work with my clients. I became trained in traditional and Ericksonian hypnosis in the early 1980s. I was not pain-free until I found a chiropractor who was proficient in applied kinesiology in the early 1990s. Dr. Force suggested I take Touch for Health and then taught me the protocol for NET. I was also trained in EMDR, TFT, and later EFT. Tri-brain trauma therapy was the logical next step. As polarized and separate as allopathic and alternative medicine can be, the future trend in healthcare is the synthesis of the many different theories and disciplines that on the surface appear to disagree with each other, but on closer examination, all describe a valid part of the whole that is a human being.